There were no McDonald's, no Kentucky Fried Chicken, no Pizza Hut. But today, if you visit the cities in China, whether it's Beijing, Shanghai, or even medium-sized, small size of cities, you will find every corner these American enterprises there. They usually will be built, just like in this country, I guess, in the intersection, or in somewhere it's very obvious, intersection area, corner, I should say, in the corner street. Now, when we were in China, we love to go to McDonald's. And we sometimes also like to go to Kentucky Fried Chickens. Especially, I did my graduate work in Kentucky. So I feel I should go to Kentucky Fried Chickens. Do you know why we wanted to go to McDonald's and Kentucky Fried Chickens? They had the cleanest restrooms. Some of the restaurants in town, you don't want to even go in. I can go in, no problem. But my wife will go in a little bit. She come right out. I said, did you already finish your business? She said, I could not do it. I said, you're going to suffer then. I said, okay, let's go on to McDonald's, since every corner has McDonald's. So there's a lot of increase there. And I want to tell you a little bit about our experience in China this year. As mentioned earlier, we spent 2 months this year, June, July, August, in China. There's really an exciting news. I mentioned China faced multiple health crises. But the good news is, just last year, a new organization called Chinese Institute of Health was founded in Beijing. With the blessings of Chinese central government. The main objective of this institute is to cut down the incidence of disease of affluence. And this year, actually last year, when this institute was founded, I was approached to be the director for the institute. So I finally decided I will give it a try, because when I look into the goal of this institute, I find it very, very interesting. The goal is to train 10,000 health workers so that they can go to cities and villages to teach people the new style of lifestyle. I said, this is excellent. This year, we arrived in Beijing in June. Of course, in addition to assuming the post as a director of Chinese Institute of Health, we were assigned to teach right away. So Esther taught the course, diet therapy and clinical nutrition. And together, we present courses in prevention and treatment of diseases of affluence. In our first few weeks, as we were teaching, we noticed there were older students in our class. These older students, we checked, they were not on the picture book or the rosters of the student rosters we have. And later on, we discovered these were actually civil leaders and church members who had diabetes themselves. So they came to attend the class, to learn the material, and actually to follow the recommended diet and exercise program with our students together. Most of them stay for 3 weeks. One of them actually stayed for only just 5 days. Interestingly, they all were able to keep their blood sugar under control. They either greatly reduced the medication or off medication completely. Our students were just amazed at the result of the lifestyle program. Now, a question I'd like to ask, will we be able to see this kind of result in America? I believe we will be able to see it, as already demonstrated by my colleagues in different parts of the world, in different parts of the country, I should say. However, I do recognize we're going to have resistance and skeptics. Many will say, I cannot change my lifestyle. I will rather just take the medicines. Besides, my insurance will cover the medicine anyway. Now I want to ask, how effective are the medicines? Speaking of diabetes, have you seen anyone actually get well from diabetes by taking medicines? Most of you shake your head. I have not seen it either. I have not seen it. Because the medicine only just treat the symptom. We might say just cover up the symptom, and the cause remains. Cause is still there. So the problem will not be solved. Treating the symptoms, not the cause, will not work very well. That's why the results are not very good. No wonder many people have been told that they just need to take the medicine. Continue to take the medicine for the rest of your life. Now, speaking of anti-diabetic medications, and their side effect too. In fact, the last few months I've been receiving notice telling me that one of the very popular anti-diabetic drugs actually has been shown to have very severe side effects. The side effects including heart attack. This popular anti-diabetic drug actually will cause heart attack, congestive heart failure, stroke, liver failure, even death. European countries have already banned this drug. China also banned this drug just this past year. Right now, there are 13,000 lawsuits against this drug. The company has settled out of court 11,000 cases, paying many $1 million. There is a better way. The seminar this weekend is to share with you the better way. This afternoon, my wife would share with you more tangible and concise information. Now let's review the 3 Bible texts we studied today. Exodus 15:26 talk about Egyptian diseases happened many years ago. Today we are also having Egyptian diseases right here in our land. And Leviticus 3:17, God recommends that stay away from fat and blood. Genesis 1:29, let's return to the basic, and let's have plant-based diet. I recognize changing lifestyle is difficult. For some of us, without eating lots of meat, it's also very difficult. So I've been telling all the people, prepare food. Make sure you make it tasty. If you don't make it tasty, even I will not eat the food. So Janet has a report, has an announcement, or Susan? Okay. And we want you to come back after this lunch this afternoon. We'll have more time to dialogue again.